just caught up with Dr. Seymour Hart outside the Health Policy Conference, and he's going to speak a little bit on the subject today and share his thoughts on healthcare reform. So, Dr. Hart, what do you think?
Well, today was really extraordinary. I mean, I came out to this conference and this man was speaking at the stage, Miguel Cohen, something like that, Miguel H. He uses the H because, you know, there are lots of Michael Cohens, and it's very common, especially in my country. And so he uses the H. You know, what's interesting about the H is that there are two pillars. You know, one is law and one is spirituality, and then in the middle is the physical body, which is mediating like the material and spiritual. Health also stands for healthcare. So this was Michael H. Healthcare, H is for healthcare, lawyer Cohen. And I find what he's thinking extraordinary. I mean, excuse me, that was a bit of spittle. I got very excited, you know. When I was a boy, I used to study Shakespearean theater, and oh my God, one time I did King Lear with the Royal Shakespeare Theatre Company. The emotion, the words I was saying to my daughters, it was moving. It was pulsating through me. It wasn't even acting. It was a real experience. Anyway, let's talk for a moment about healthcare reform. What would you like to know? Would you like to know what I got from his presentation?
Well, we'd like to know what's the biggest thing that you'd like to see in healthcare reform?
Well, you know, he was talking about the business and professions core. I can't even say it. My God, the business and it's a lot to even say. I can get the chet out, you know, like chomes and charoses, but can I say business and I mean, my God, those legislators have to go back. Let's just call it the code. Anyway, Section 2242.1 of the code has recently been amended to allow prescribing without even seeing the patient. I mean, this one case, the physician prescribed and he did not even know the gender of a patient. I mean, can you imagine? I mean, even if my long hair, you know, even if I make a ponytail, let's just say, let me just show you the back here. Oh my God, it's so beautiful. I can tie this thing. Anyway, you know my gender, and I know that, you know, there is some different gender issues, so I'm not like treading on any political sensitivities, but the point is, you cannot tell a gender from a questionnaire. Somebody could be lying, they could be representing themselves as one thing, but another, it could be, I don't know, a talking horse. I mean, you don't know who's filling out the questionnaire, whether they're getting paid to fill it out. Could be somebody in another continent, perhaps. So he complied with 2241 of the Business and Professions Code, but he violated standard of care. The point that a professor, he used to be a professor, now he's a lawyer, he was making is that you have to be sensitive to all of these legal issues. That's why you need a good lawyer, you need a good law firm, you need a law firm that has good marketing videos, and that's why I'm telling you about this. Oh my God, oh, the food was just incredible. Look at this waterfall. I'm literally walking on water here. Anyway, have a wonderful day, and from my heart, you know, I'm Dr. Hart, and I'll see you later.
Thank you so much, Dr. Hart.
Thank you. Bye.